Depression is a serious and important issue for students. College students are susceptible to depression due to potential factors such as stress with school, work, or finances, or possibly feeling isolated after moving away from friends and family. College students should know that depression is different from occasionally feeling sad or stressed. Depression is a serious but common and treatable medical illness. No one should suffer needlessly in silence. Check out this National Institute of Mental Health report on depression in college students for more useful information. Symptoms of depression include a depressed mood, feeling sad, empty, or hopeless, lack of interest or pleasure in activities that you used to enjoy, fluctuations in weight, difficulty with sleeping, low energy, feeling worthless, feeling guilty, difficulty concentrating, difficulty making decisions, feeling irritable, feeling restless, and/or feeling suicidal. The symptoms of depression can cause it to be difficult to function in day-to-day life, and as symptoms become increasingly unmanageable, students may even begin to feel suicidal. Feeling suicidal needs to be addressed right away. The Center for Disease Control and Prevention reports that suicide is the second leading cause of death for individuals aged 15 to 34. Anyone who is feeling suicidal needs to know that this is a serious symptom of depression. You are not alone, and you do not need to cope with suicidal feelings alone. With help, you can get relief and feel better. Traditionally, when we think of trying to manage depression, we think of engaging in therapy or taking medication. While those things are helpful, and are often recommended for anyone with clinical depression, there are many other things that can also be helpful that are sometimes overlooked. Additionally, there are many ways to deal with depression that have better long-term outcomes and lower relapse rates than psychotherapy or medication alone. Many of the 10 coping strategies listed here go hand in hand and can build on each other, incrementally increasing your overall sense of well-being. For example, if you are exercising and eating well, you will also likely be sleeping well. We hope this list will offer you effective strategies for dealing with depression in college. Engage in psychotherapy. No one should cope with depression alone. Trained and licensed mental health professionals can provide support in helping you to find relief from your symptoms. Psychotherapy can help individuals identify what issues are contributing to their symptoms of depression, and how best to address these issues. As the American Psychological Association reports, psychotherapy can help reduce symptoms of depression and also prevent future episodes of depression. Explore medication options. If you are experiencing symptoms of depression, it is generally a good idea to talk with your primary care provider about this. Your doctor can help you rule out or treat any medical issues that may be contributing to symptoms of depression. Nurse practitioners, doctors, and psychiatrists can all prescribe medication to treat depression. After talking with you about your specific symptoms, your medical provider may request that you try meeting with a mental health therapist before starting medication. However, sometimes psychotherapy is not enough for more severe forms of depression, and you, your therapist, and your doctor may decide that medication would be helpful. Fortunately, advances in medicine have provided a number of medications that can be effective in treating depression. Practice mindfulness exercises. Mindfulness can be defined as staying aware and conscious in the present moment. While it sounds simple, being mindful is not easy. It can take a great deal of practice to develop the ability to be conscious and connected in the present moment. Students may find themselves managing so many different commitments, classes, work, friends, at a time that they have a hard time staying focused without thinking about what they need to do next. And it can seem almost impossible to imagine staying in the present moment when managing frequent distractions on our ever-present phones. Spend time in nature. It may seem simplistic, but spending time in nature has been shown to reduce symptoms of depression. There is a model of therapy built around the philosophy that spending time in, and connecting with, nature will improve mental health. This is called ecotherapy, and is also known as green therapy, or nature therapy. There is lots of research to back up ecotherapy. The benefits of spending time outdoors in nature have been looked at by researchers all over the world. In Japan, there is a custom called forest bathing, which essentially means spending time around trees. Exercise. Exercise has countless physical health benefits such as strengthening your heart, lowering blood pressure, reducing body fat, and improving strength. Exercise has also been shown to have numerous mental health benefits, including reducing stress, anxiety, and depression. Students can also benefit from the impact that exercise has on the brain, including improved memory and thinking skills. Strengthen your social connections. Going to college often means moving away from friends and family and starting a new life in a new town or city and meeting all new people. This can be hard and overwhelming at first. Putting time and energy into meeting new people and developing friendships is important for your mental health. Improve your nutrition. Everyone knows that when you eat well, you feel well. However, when you are in college, it can be hard to find the time to eat, let alone the time to shop for, prep, and cook healthy foods. But eating healthy doesn't have to be hard or overwhelming. Even the simple act of trying to add more healthy, nutrient-rich foods into your diet will cancel out some of the other less helpful foods. Improve your sleep habits. All of us have seen firsthand how we suffer when we get behind on our sleep, but there is research to back up this anecdotal evidence. The American Psychological Association, APA, explains why college students don't get enough rest, reasons such as social commitments, stress, and trying to fit in time to study. However, sleep is critical to your mental health, and learning how to prioritize and get good sleep is an important life skill. Avoid drug and alcohol use. Talking about alcohol use in college can be hard because it has become a big part of the culture. Drinking in college, even underage drinking, has become quite normative. It is important for college students to understand the potential negative health impacts of drug and alcohol use in college. Students who are experiencing symptoms of depression could benefit from avoiding drug and alcohol use. Set healthy boundaries. One symptom of depression is a feeling of worthlessness or excessive guilt. Sometimes when we feel worthless or guilty, we have a hard time saying no, or setting boundaries in our best interest, because we are more worried about what the other person wants or needs than what we want or need. In college, we might feel pressure to say yes to everything due to a sense of pressure to enjoy every moment or seize the day. We may feel we need to say yes to every study group, every party, or every time a friend asks us for help with something. However, this approach can backfire. In an effort to try to enjoy and do everything, we may be left unable to enjoy or do anything. If you have depression, you might also want to watch this video, How to Overcome ADHD Paralysis. It might be related, and can help your life getting better. Make sure to like, comment and subscribe. See you on the next video.